Hi, good afternoon. My name is Lisbeth Armijos, and I am going to speak about the acute hydrophilic-Polymer nephropathy and acute renal failure. First, we have the definition. Hydrophilic polymers are non-hydrolytes that are formed by a three-dimensional network that has the ability to absorb a large amount of water, swelling, and considerably increasing its volume without losing its shape. This is until reaching its maximum degree of hydration or swelling index. Kidney failure is called a condition in which the kidneys suddenly stop filtering waste from the blood. This is how acute renal failure develops rapidly in a few hours or days. It can be fatal, in which it is most common in those who are critical ill and are already hospital.
This video, we're going to look at acute renal failure, which is defined as a decrease in glomerular filtration rate. And I put reversible because in quotations because it may be reversible. But essentially, it's damage to the kidneys, which will cause a few problems, many problems actually. And so we'll look at these problems and some causes of acute renal failure. So here I'm just drawing the anatomy. Here we have the kidneys, the inferior vena cava, where the renal veins drain into. And then we have the ribs here. And here is the diaphragm. And here we have the aorta, which will supply the kidneys through the renal artery. And here we have the pelvis. And now the kidneys, as we know, produce urine, which will travel through the ureter and go to the bladder. And urine is stored in the bladder, and when needed, the bladder will contract and expel urine through the urethra. Now above the kidneys, we have glands known as adrenal glands, which are important because they produce some important hormones. Okay, now I want to talk about the main causes of acute renal failure. And there's three main ones. It can either be pre-renal, before the kidneys, intrarenal, within the kidneys, or post-renal, after the kidneys. So these are the main causes. But now we will focus on each one and look at these in a bit more detail. So pre-renal cause of acute renal failure can be due to a sudden or severe decrease in blood pressure, or it can be due to a flow obstruction to the kidneys, and this can be due to atherosclerosis or some form of ischemia, so stenosis. And then you have intrarenal cause. Now, intrarenal causes include direct damage to the kidneys itself, inflammation within the kidneys, a form of infection, drugs, as well as autoimmune diseases such as systemic lupus erythematosus. I hope I pronounced that right. And then the third one, the post-renal cause of acute renal failure, include mainly an obstruction of urine flow. So this can be due to a benign prostatic hyperplasia, kidney stones, as well as some form of bladder injury or tumor. Now we will mainly focus on intrarenal, which is the most common form of acute renal failure. So it's the most common cause. Now, before we look into that, we should just quickly brush over the anatomy. So here I'm drawing the right kidney, the ureter, the renal pelvis, the renal pyramids, which are within the renal medulla. And around this area are the functional units of the kidneys, which are called nephrons. So let's just zoom into one of these nephrons. So here I'm drawing one nephron. It has the head, which is the Bowman's capsule, and then we have this convoluted part called the proximal convoluted tubules, which then forms the loop of Henle, and then we have the distal convoluted tubules, and then the collecting duct. So let us briefly look at the function of the kidneys, of the nephrons. So in summary, an afferent arteriole will carry blood from the renal artery. This afferent arteriole will come down and it will be filtered in the glomerulus. And this occurs in the Bowman's capsule, the head of the nephron. A term to note is the glomerular.
Now we have the application in medicine. Acute host-paid nephropathy is an entity that should be taken into account in case of acute renal failure with a history of having used sodium phosphate solution and with compatible histologic findings, since it may be the cause of chronic kidney disease in some patients. Given the growing numbers of this study, it is necessary to review the possible risk factors for this development and adopt prevention measures. Symptoms and signs of acute kidney failure include decrease in the volume of urine excrete, called diuresis, although it sometimes remains stable; fluid retention, which causes a swelling in the legs, ankles, or feet; shortness of breath; fatigue; disorientation; nausea; soft spot; irregular heartbeat; chest pain or thickness; seizures or coma in several cases.
So let's understand in brief the consequences of acute impairment of normal kidney function. First, coming to the nitrogenous waste. The nitrogenous waste of the body gets raised, which is represented by increased concentration of blood urea nitrogen as well as increased serum creatinine values. Various types of electrolyte imbalances can occur in acute renal failure, like the serum sodium concentration gets decreased, serum potassium gets raised, serum calcium gets decreased, the serum phosphate concentration is raised, but the serum pH gets decreased, that is, the blood becomes more acidic. One simple trick to remember all of these electrolyte imbalances is to remember two sets of ions, the sodium, potassium, calcium and the phosphate, and to remember that the normal serum sodium is higher as compared to potassium, whereas the normal serum calcium concentration is higher as compared to phosphate, and these arrows just get reversed in case of ARF. One important problem in ARF is the fluid imbalance. Since kidneys are not functioning properly, the body can have hypervolemia, that is excess body water, or hypovolemia, that is deficit body water. Hypervolemia mainly occurs in oliguric and anuric ARF when the kidneys do not produce enough urine and the water gets retained in the body. And hypovolemia occurs in advanced ARF when the kidneys lose their property of concentration.
Now we have the pros. To classify acute renal failure, it may be more beneficial to distinguish between conditions that reduce glomerular function, conditions that result in injury to the tubules and or glomeruli, and conditions that do both. With regard to the enzyme called albumin, it is said that the use of this hasn't shown damage to the kidneys. About the cons regarding the disadvantage is that there is presence of accumulation of liquid. That is, acute renal failure can develop fluid accumulation in the lungs, which can cause difficult breathing, and this leads to the patient's death. Now we have the pros. To classify acute renal failure, it may be more beneficial to distinguish between conditions that reduce glomerular function, conditions that result in injury to the tubules and or glomeruli, and conditions that do both. With regard to the enzyme called albumin, it is said that the use of this hasn't shown damage to the kidneys. The cons regarding the disadvantage is that there is presence of accumulation of liquid, that is, acute renal failure can develop fluid accumulation in the lung, which can cause difficulty breathing, and this leads to the patient's dying. About the issues applied in Ecuador, update base of this year, there is no record of an exact number of patients suffering from these dishes. However, there is a study that shows that in 2016 there were 20,182 discharges in the health system of patients with kidney damage. 10,229 were due to kidney failure, with men being the most affected. This is what the 2016 Health Statistic Yearbook, published by this state portfolio, says. In Ecuador, the health authorities estimate that about 10,000 people are undergoing hemodialysis and peritoneal dialysis treatment.
Acute kidney injury, AKI, also known as acute renal failure, is a sudden, rapid loss of kidney function, typically within days or weeks. The function of the kidneys is to filter blood plasma, removing metabolic wastes in urine while also adjusting urine composition to maintain balance of various blood parameters. In AKI, metabolic wastes accumulate, and fluid, electrolyte, and acid base disorders may develop quickly. Of the many possible complications, most serious are potassium overload, hyperkalemia, and excess of fluid volume, or hypervolemia. Usually, both kidneys must fail for AKI to be diagnosed. While AKI can be caused by a rapidly progressing intrinsic kidney disease, it is most commonly a consequence of an underlying condition outside the kidney. Causes are classified as pre-renal, renal, and post-renal, with pre-renal being most common. Urine formation occurs in the functional units of kidneys, called the nephrons. Blood enters the nephrons via the afferent arteriole, passes through a ball of capillaries called the glomerulus, where filtration takes place, then leaves via the efferent arteriole. Blood pressure inside the glomerulus must be high enough to enable filtration. This is achieved by having the afferent arteriole significantly larger than the efferent arteriole, creating a blood flow with a large inlet and small outlet.
Finally, we have the conclusion. It is concluded that acute renal failure must have a first instance diagnosis since kidney injury is too damaged in a matter of time for the patient to die. This is how it is determined that once the patient is under observation due to swelling, the first line drug to use is furosemide. However, for the expulsion of this drug, a physiological analysis must be carried out. That's all. Thanks for your attention.